What is mesothelioma? The topic of mesothelioma is one that is very close to my heart. My father was diagnosed and had a very long, hard battle with the disease, and he eventually lost his life. I knew that my father was sick, and I did know that he was diagnosed with mesothelioma, but I was not educated on exactly what that was. I was surprised to learn that statistics indicate that malignant mesothelioma is a severe form of the disease, and it accounts for about 75% of all instances of mesothelioma. That was provided to me by Cartel 2016. I would like to share with you more of the things that I have learned in the role of a nursing assistant over the course of the treatment. Mesothelioma is defined as a type of cancer that occurs in the thin layer of tissue that covers the majority of your internal organs, or the mesothelium. That was provided by Mayo Clinic. This is a deadly and aggressive form of cancer and most often affects the tissue that surrounds the lungs. As it spreads over the lungs, it causes the outer lining to become thick and lose elasticity. Rarer forms affect the tissue in the abdomen, around the heart, and around the testicles. Symptoms of mesothelioma can vary depending on where the cancer occurs and how it is progressed. Symptoms to watch for include chest pain, painful coughing, shortness of breath, unusual lumps and tissue under the skin in your chest, or unexplained weight loss. These symptoms can also be related to other conditions. You should always tell your doctor if you have these symptoms and have been exposed to asbestos. Pleural effusion is a buildup of fluid in the chest, causing breathing to be difficult and is a complication of this condition. There are several treatment options. Some are more invasive than others, but none can promise a cure. Some treatment options include surgery, where they would insert a tube to your chest to drain the fluid, relieving the pressure. Another surgery that can be done is to remove the tissue lining of the lungs that produce but this procedure will not cure mesothelioma, but it can lessen the symptoms. Chemotherapy is also a treatment option, where they use chemicals to kill the cancer. This treatment travels throughout the body and can shrink or slow the growth of the cancer. Medication is another form of treatment, but rather than trying to fight the cancer, this treatment helps to treat just the symptoms of the condition. Doctors may advise the person to take an over-the-counter pain reliever and then be prescribed some opioids like morphine. Sometimes those are needed to treat severe pain or even breakthrough pain. Prednisone can be used to reduce the swelling surrounding the cancerous tumors to relieve the pressure. The person may also be prescribed an antidepressant to help with any depression that may occur. A nursing assistant plays a very important role in the care and treatment plan of a person with mesothelioma. I believe a nursing assistant is the eyes and ears of the medical staff since they work so closely with the people they are caring for. As a nursing assistant, you can help to make a person comfortable in bed or while sitting by applying some extra pillows. You are also able to massage an area that might be causing a person pain or provide a hot compress to a muscle that may be sore. Encouraging a healthy lifestyle might help to give the person more energy and make them feel a little bit better. It could also extend the survival time. A nursing assistant may also practice breathing techniques to help the person to ease the difficulty breathing. Monitoring vital signs and overall health and appearance of a person is another measure that you could take using or being a nursing assistant, and reporting any changes right away to a nurse. A very important care a nursing assistant can provide is just being there for the person. You can do this by just listening to what the person may have to say, responding back to the person with a kind, heartfelt response. There are many times that having someone to talk to and share things with is the most effective treatment at that moment. Again, mesothelioma is an aggressive form of cancer that typically results in death. Nursing assistants, along with other medical staff, are very important parts of the treatment of this condition. Battling a condition like mesothelioma is not easy. It is emotionally and physically draining, not only for the person going through it, but for the others surrounding that person also. This form of cancer is by no means any easier to talk about than any other form of cancer. But I believe with research and education, there is hope in the fact that one day we may not have to discuss this topic. Thank you very much, and have a great day.